President Trump's proposed budget plan could threaten America's ability to fight health threats. Former CDC Director Tom Frieden outlines his concerns in a new op-ed for Time magazine. He says the agency he led for 8 years now faces unprecedented and potentially catastrophic cuts.
Dr. Tom Frieden is with us now from Washington. Doctor, the Trump budget proposal calls for reforms to the CDC through a new $500 million block grant awarded to the states. Now, in your piece for Time, you say that these block grants are just bad government. Can you explain why you feel this way?
Well, first off, the question is how many resources do we devote to protecting Americans? The CDC protects Americans. It works 24/7 to do that, and it can only do that if it gets the resources from Congress. But in addition to the amount of money provided for protection, there's also how it's provided. Block grants basically send a blank check to the states and say, use it how you see fit. That may be good policy for some parts of government. For public health, it's really bad government. You cannot give guidance. You cannot make sure that the programs that are implemented are the ones that work. You can't make sure that the states don't use it to replace their own money. You can't hold them accountable. It's not being diligent stewards of the money that is entrusted in CDC. So a block grant really undermines accountability and it undermines effectiveness.
So the proposal doesn't specify where the $500 million in block grants would come from. So where do you believe these cuts are going to be made?
Very hard to predict. I would predict that block grant is a result of lumping together a bunch of very important programs, reducing them, and then trying to hide the fact that that's being reduced. But we don't know what will happen in the end. We haven't seen the details from the administration. And, of course, it's up to Congress to determine what actually happens with the budget.
You know, you also remind people about the emergence of tuberculosis in the 80s, a particularly strong strain. And you say that it was a direct result of these sort of policies, these block grant policies. You're worried that moving forward we could see something similar happen.
Absolutely. In the 1980s, tuberculosis control was put into a block grant, then it was cut, then tuberculosis came roaring back in drug-resistant forms that ended up costing this country more than $1 billion in hospital and other care. Similarly, right now, CDC has very important programs that help states and communities prevent outbreaks in hospitals or from food sources or address our leading causes of illness and disability and death. If those programs are cut and made less effective, not only will it cost lives, it will cost us money.
So the Trump budget does create a new public health emergency fund. That's something you lobbied for during the Zika and Ebola outbreaks. What will this fund enable that agency to do?
The devil is in the details, but it's a very important idea. When we have an earthquake or a hurricane, FEMA doesn't go to Congress and say, please send us some money so we can help this community. In contrast, in public health, it can take many months for us to get the resources and the permissions or authorities to act in an emergency. It's very important that Congress make an emergency fund available and that it's able to be used efficiently. That way we can stop an outbreak when it first starts before it becomes an epidemic.
Now, we're talking about the budget proposal, but later on today, the House plans to actually vote on their piece of legislation that would repeal Obamacare or replace Obamacare. What are your concerns about that new health care bill?
You know, the bottom line with health care is that if we can cover more people with better quality at lower cost, we can save lives. So any proposal should be judged against those three core areas. Do they cover more people? Does it improve quality of care, and does it reduce cost? And by cost, I don't mean reducing cost by denying care to some people or denying coverage to some people, but reduce the cost per person per year so that we're providing more health for the same or less money. That's the goal of the healthcare system. All too often what we're seeing in healthcare is that we're paying for volume. We're paying for how many patients a doctor or nurse sees rather than how much health is improved or protected.
It's a fascinating piece in Time. Dr. Tom Frieden, thank you for your time.
Thank you.